Watch your dog's side while they sleep tonight, and if it is moving in and out faster than it did a month ago, that is not a dream, and it is not the heat. That single detail, counted properly, is something a heart specialist would want to know about right now, tonight, before anything else happens. Most people are taught to watch for coughing or fainting or a dog who suddenly cannot finish a walk, and wait for one of those before they worry about the heart. By the time any of those show up, the heart has usually already been struggling for a while. There is a quieter number, one that shows up first and almost nobody thinks to check it, because nobody ever told them it existed. Here is the part that trips almost everyone up before they even start. If you go check your dog's breathing right now while they are awake, sniffing around, maybe a little excited that you're paying attention to them, the number you get means basically nothing. The number that matters only shows up in one very specific window, and understanding why that window matters is exactly where this starts. If you have owned a dog with a heart murmur, or you have a small breed getting older, and some quiet part of you worries you will miss the moment things start to turn, that worry is not something to feel bad about. It is exactly why you clicked on this. Wanting an actual method instead of low-grade dread already puts you ahead of where most people are. Nobody hands you a stopwatch and a breathing chart when you bring a puppy home. Nobody hands you one even after a vet mentions hearing a murmur at a checkup either. Most owners walk out of that appointment with a diagnosis and no real sense of what to actually watch for between visits. Learning this tonight is not proof you missed something. It is just you, catching up on something almost nobody gets told, the same way almost nobody gets told to check a tire's tread until a mechanic points it out. You are not behind. You are just about to be one of the few people who actually knows what to look for. There is a myth sitting underneath all of this, and it is worth taking apart before anything else, because it is the myth that keeps people from ever checking. The myth is that a dog who still plays, still eats fine, still seems like themselves during the day, cannot possibly be developing a heart problem. And the myth says the first real sign, when it comes, will be dramatic. A collapse, a wet, rattling cough, a walk that suddenly has to end early. People believe this because those are the moments that actually send a dog to the emergency vet. So those are the stories that get told, the ones everyone hears about, the ones that make it into group chats and comment sections. What almost nobody talks about is the version that doesn't send anyone anywhere. The version where a dog looks completely fine for weeks, while something underneath is quietly shifting. The truth is slower and much quieter than that. Congestive heart failure in dogs is, in the vast majority of cases, a gradual build, not a switch that flips. Fluid starts collecting in and around the lungs long before a dog seems sick in any way you'd notice during the day, because a dog lying still has no adrenaline in its system to mask the extra work its lungs are already doing. The number we're about to talk about can climb for days, sometimes weeks, before a cough or a collapse ever shows up. And that gap, that quiet window before the obvious signs, is exactly what makes this test worth 2 minutes of your night. If that reveal is already changing how you're going to look at your own dog tonight, this is a good spot to pause for 1 second. Drop a comment with where you're watching from. Subscribe if you want more of this kind of practical, no-nonsense breakdown. And if you think this could help another dog owner catch something early, a like genuinely helps it reach them. None of that costs you anything, and it actually matters. So here's the mechanism, in plain terms, because understanding it briefly is what makes the number make sense. In a lot of small breed dogs, one of the valves inside the heart, the mitral valve, starts to leak as they get older, letting blood slosh backward instead of moving forward the way it should. In larger breeds, it's sometimes the heart muscle itself that weakens instead. Either way, pressure starts backing up into the blood vessels running through the lungs, the way water backs up behind a dam that is starting to lose the fight. Fluid begins seeping out of those vessels into the surrounding lung tissue. Vets call that pulmonary congestion, which just means fluid building up around and inside the lungs, the stage right before the lungs are actually flooded, which is what congestive heart failure really is underneath the label. And here's the part that matters to you specifically. Lungs that are getting stiffer and heavier with fluid cannot expand the way they used to, the same way it's harder to pull air through a soaked sponge than a dry one. So the body compensates the only way it can, before any other symptom shows up. It breathes faster, even resting, even fully asleep, just to keep enough oxygen moving through a pair of lungs that are quietly working against more resistance than they used to. That faster resting breath is often the earliest outward clue that pressure has started shifting inside the chest. Before a cough. Before your dog seems tired on the walk you take every day. Before anything you'd notice with your eyes during normal daytime activity. It shows up first in a number, while your dog is doing nothing at all. That number, though, rarely tells the whole story, sitting there by itself. A rising breath rate almost never travels completely alone. It tends to sit alongside a handful of other small, easy-to-miss things in a dog's day. An energy dip here, a changed appetite there, a nap pattern that's shifted, and it's usually only once you see a few of those pieces together that the fuller picture of what's actually going on with your dog starts to come into focus. If you're not sure how the pieces in your own dog's case fit together, or which one is worth paying attention to first, we put together a free 2-minute quiz that reads your dog's fuller picture and hands you a simple starting plan, the first few steps, in order, built around your own dog specifically. To be clear, the quiz doesn't diagnose or treat anything about the heart. That part always goes through your own vet. It's just there to help you organize the bigger picture and know where to start. The link is in the pinned comment, or you can scan the QR code on the screen. Finish this video first, though, because the step that plan is actually built around is the one we're about to walk through together. Now, what you're actually watching for. A healthy dog deep asleep usually breathes somewhere between about 15 and 25 times a minute, a smooth, slow rise and fall of the chest, occasionally touching 30 on a warm night or after a big dinner. And none of that alone is a reason to worry. That range holds pretty steady whether you've got a 10-pound dog or a 100-pound one. Size changes the size of each breath, not really how many the dog takes in a minute at rest. What starts to matter is a rate that sits consistently above roughly 30 breaths a minute at full rest, not just once but across several nights in a row, or a rate that keeps creeping upward week over week, even while your dog seems completely normal in the daytime. A single warm night or one overly excited bedtime doesn't count. It's the pattern across nights that tells you something real. There's a cough worth separating from an ordinary one, too. A soft, dry cough that shows up at night or right as your dog is settling down to sleep is different from the occasional cough after gulping water too fast. A cardiac cough tends to repeat, and it tends to happen specifically in that moment of lying down and going still. Getting tired faster than usual on a walk your dog used to handle without a second thought is another pattern worth noticing. Needing more breaks, falling a few steps behind where they used to walk ahead of you. That's different from ordinary tiredness after a longer walk on a hot day, mostly because it starts happening on the same walk your dog has always handled just fine. The same route, the same distance, the same time of day, just with a dog who suddenly needs to stop and catch their breath halfway through. In smaller, older dogs, this can look like flat out refusing the second half of the walk, planting their feet and turning back toward home. In bigger dogs, it's often more subtle, a slower pace they've never needed before, or choosing to lie down the second you get back instead of trotting around the yard the way they used to. If you've noticed any of this already in your own dog, you are not imagining it, and you are far from the only one watching for it tonight. A belly that looks fuller or more rounded than usual, without any change in how much your dog is eating, can point to fluid building up in the abdomen in more advanced cases. That's different from ordinary weight gain, mostly because it tends to show up alongside the breathing changes, not on its own, out of nowhere, and it often comes with a dog who seems uncomfortable lying flat on one side the way they used to sprawl out before. And then there's the one sign that always counts as urgent. No exceptions, no waiting to see if it happens again. A brief, sudden collapse or wobble, sometimes just a few seconds of your dog seeming to lose their legs before bouncing right back up like nothing happened. Maybe after a burst of excitement, maybe out of nowhere. Vets call that syncope. It can look almost nothing, over in a blink, easy to explain away as a slip on the floor or a weird stumble. It is never something to wait out or write off as clumsiness, even if your dog seems completely fine 30 seconds later. That one gets a same-day call to the vet, every single time, no exceptions. Here's where this gets heavier before it gets useful, because none of these signs happen in isolation, and none of them show up as the very first stage of the problem. Left unwatched, a rising resting breath rate usually keeps climbing quietly for days or weeks with no other visible sign at all, simply because a resting dog has no reason to show effort yet. As the fluid buildup continues, that soft nighttime cough starts to appear, often waved off as your dog just getting older or sleeping in a different position than they used to. From there, daytime energy starts dropping in small, easy-to-miss ways. Walks get shorter without it feeling dramatic. Naps get longer. Left unaddressed past that point, breathing effort can become visible even while your dog is fully awake. The belly can start to distend, and the risk of a sudden crisis, including that collapse we just talked about, climbs sharply. Every single one of those stages is easier, calmer, and cheaper to manage the earlier it gets caught. That is the entire reason a 2-minute count, done tonight, carries the weight it does. Picture a small breed dog, 10 years old, call him Ozzy, whose vet had been listening to a soft heart murmur at his checkups for close to 2 years. Still playful, still finishing every meal. Nothing about him looked any different from one day to the next. Nothing his owner could point to and say, "That's new." His owner started counting his sleeping breaths mostly out of curiosity after hearing something like this, and over about 10 days watched the number drift from around 20 up into the high 20s, then sit there. No cough yet, no real tiredness yet, nothing you'd notice without the count. The vet visit that followed caught early fluid buildup before anything dramatic ever showed up, and a small medication adjustment brought things back under control in a way that, by his owner's own account, felt almost too easy set against what might have happened if that number had kept climbing another month unnoticed. That's not every case, and it's not a promise, but it's exactly the kind of quiet catch this habit is built for. Ozzy's story is a reminder of exactly what that quiet number is for. Catching a shift before the obvious signs ever show up, while there's still an easy, calm way back. So here's exactly how to run the count, step by step, the same way it's done at home for dogs already being followed for heart disease. Step 1 is picking the right window, and this is the part almost everyone gets wrong the first time. The count only means something when your dog is completely calm, ideally in a deep sleep, chest moving slowly, not right after play, not after a walk, not panting, not dreaming with their legs twitching, and not right after a big meal. An afternoon nap works, so does once they've fully settled in for the night. Anything else and the number you get is just noise. And if you catch yourself with a number that looks alarmingly high, check first whether your dog was actually fully asleep or just resting with one eye half open before you assume anything is wrong. Step 2, you watch, you don't touch. Sit or stand somewhere you can clearly see your dog's side or belly without disturbing them at all. One full breath is the chest moving out, then back in. That's 1 count. For a small dog, a toy breed, or a puppy, this movement can be subtle enough to miss entirely, so a phone flashlight held low, across the body and never on the face, can make it easier to catch without waking them. For a bigger, deep-chested dog, a Labrador or a Shepherd type, you'll usually see it easily from clear across the room, sometimes even from the doorway. If your dog sleeps curled into a tight ball, try to catch a night when they've stretched out on their side instead. It makes the rise and fall much easier to read. Step 3, count and multiply, or just count the whole minute. Set a timer, count every breath for 30 seconds, and multiply by 2. That works fine most nights, and it's fast, and it's usually enough to catch a dog who's drifting out of their normal range. Once a week, though, it's worth doing the full 60 seconds for a more reliable number, especially if your dog already has a known murmur, since a full minute smooths out the odd breath here or there that can throw off a shorter count. Step 4, and this one actually matters more than people expect. You write it down. Date and number, in a notes app or a little notebook by the bed, whatever's easiest. A single number on its own tells you almost nothing. A trend across 2 weeks tells you almost everything. If your dog has a known mitral valve murmur, the 2 minutes a night is worth it. If your dog is healthy with no diagnosis, once or twice a week is plenty to build a baseline you can actually trust later. Step 5, and this is the number that actually earns a phone call. Staying under about 25 most nights is reassuring. A rate that creeps up toward 30 and stays there across 3 or more nights, or that jumps 10 or more breaths above your own dog's normal baseline, is what earns a call to your vet that week, not a panic, just a proper check. This count never replaces listening to the heart with a stethoscope, chest x-rays, or an echocardiogram, which is the ultrasound that actually shows how the valves and chambers are moving. All this number does is tell you when it's time to go ask for those. A couple of honest caveats here, because this only works if you use it right. One high count on one night, especially right after excitement, warm weather, or a big dream, doesn't mean heart failure. It means recheck it calmly tomorrow before drawing any conclusion at all. What earns the call is a trend that holds across several nights, not one number out of context. And this next part matters a lot, so it's worth saying plainly. Never start, stop, or change any heart medication, including diuretics like furosemide, based on a breathing count by itself. That decision, every time, belongs to your dog's own vet, and it depends on exams you genuinely cannot run from your living room. If your dog is already on heart medication and the sleeping rate is rising anyway, that's worth a prompt visit, because it can mean the current treatment needs adjusting. And that's honestly one of the most useful things this habit catches. Some things skip the trend entirely and mean go now. Sudden open mouth breathing while resting, gums that look pale or bluish instead of a healthy pink, a rate that keeps climbing within the same single night, or any collapse. None of those wait for a pattern to confirm itself. Those go straight to an emergency vet the same night. You don't need to do this every single night forever either. And honestly, for a healthy dog with no diagnosis, doing it obsessively can tip into more anxiety than it's worth. Once or twice a week on a calm night builds a baseline you can trust. If your dog already carries a heart diagnosis or a known murmur, nightly becomes worth it. And a quick glance back at the week's numbers beats reacting hard to any single off night. It's worth knowing, too, that the heart rarely works in complete isolation from the rest of the body. As it struggles to pump efficiently, blood flow to the kidneys can drop a little, which is part of why a vet managing heart disease usually keeps an eye on kidney values over time as well. Circulation running less efficiently can also mean a dog tires a bit faster during ordinary digestion and everyday activity. And there's a well-documented link between dental disease and changes in the heart valves over time, which is part of why a vet focused on the heart will usually ask about the teeth too. None of this is meant to overwhelm you. It's meant to show you that watching the whole dog, the way a vet does at a checkup, is the goal. And the breathing count is simply the one piece of that whole picture you can actually track between visits, on your own, for free. And that's really the honest version of all this. A lot of pet product marketing leans hard on wearable collars and subscription health apps, implying you can't possibly know what's happening inside your dog without buying something first. What tends to get buried under that pitch is that the single most useful heart metric you can track at home needs nothing but a phone timer already sitting in your pocket and 2 quiet minutes of attention. And it's the exact measurement veterinary cardiology programs print onto free log sheets for their own patients. Monitoring genuinely does matter, that part's true. You just don't need a subscription to do the most valuable piece of it yourself, tonight, for nothing. Your vet stays exactly who this number goes to, not someone to work around, the person you bring it to. Once things are trending back in the right direction, or if your dog has never shown any of this at all, the habit that keeps it that way is simple. Keep the count going at whatever pace fits your dog's risk, weekly for a healthy dog, nightly for one with a known heart condition, and treat any sudden jump, not just a slow drift, as worth a call on its own. Regular dental care matters here too, given that link to the valves, and keeping your dog at a healthy weight takes real, unnecessary strain off a heart that may already be working harder than it looks like from the outside. So tonight, once your dog is finally asleep, actually do it. 30 seconds, times 2, or the full minute if you've got it in you. Drop the number you get in the comments, just the number, nothing else. It genuinely helps to see what normal looks like across a bunch of different dogs, side by side. And if this changed how you're going to watch your dog tonight, go ahead and subscribe. That free 2-minute quiz is still waiting for you in the pinned comment or the QR code on screen whenever you're ready for it. Whatever number you land on tonight, put the phone down after and just sit with your dog for a minute while they sleep. That's really the whole point of any of this.